Good evening, everyone. My name is Yvette Woodruff. I'm the chair of the Policy Committee, and I would like to call to order the Oakland County Network Committee of the Whole meeting. Ms. Baird, if you could do the roll call.
Mr. Young, Mr. Furman, Dr. Giles, Pastor Jones, Dr. Guadalupe, Dr. Hans, here, Ms. Newman, you're going to have to help me on your name. Karanchuk? Okay. Ms. Karanchuk, Mr. Smith, Mr. Cowan, and Ms. Woodruff.
Present.
Okay, so both committees have quorum.
Okay, thank you. We're going to deviate the order of this meeting because council is only available for a short period of time. So we're going to come back to public comment. We're moving the union contract up, and then we're going to go into closed session after that, a brief closed session, and then come back and follow the agenda as written. Ms. Ali? Well, public comment was listed before the approval, so what do you want me to do? Okay.
It's for the, I believe, yes, and I believe Nicole is online too. Ms. Williams is online as well.
Yes. Yes,
Yep.
ma'am. Good morning. Good evening, everyone. So good evening, board. My name is Nicole Williams. I'm the Director of Human Resources for OCHN. And we recently closed negotiations with our union, represented by the International Brotherhood Engineer Workers, Local 58. This contract is being proposed for a 3-year term from October 1, retroactively of 2025, through September 30, 2028. There were no substantive changes to any contract language. We did do some modernization to the formatting of the contract. And then, of course, there were some discussion around economics, which we did have movement on the base rate maximum for the positions covered by the CBA, where the maximum pay was increased to $35 an hour. We also increased the eligibility for the longevity bonus or merit increase, opening up to those who have 3+ years of service rather than previously 5 years of service. There was also movement with the percentage of that bonus for the longer tenured staff, those who have 11+ years of service with the organization, and also newly introduced language surrounding a ratification bonus. So together, we believe this is a very fair, comparable package. The membership has voted on these changes, and therefore we're bringing them to the board for your review and consideration. Ms. Ali, anything you would add?
What was your last comment, Nicole?
Oh, I apologize. Just that the membership, which today stands at 18 members, they have reviewed the proposed collective bargaining agreement. They voted to ratify it and move it forward, hence the presentation today to the board.
Mr. Young, since that comes up under the Financial Committee.
Really bouncing around here. Okay, so I guess first of all, any questions from the Finance Committee? Any questions from Policy Committee? Chris?
I heard on the presentation an eradication bonus. Did I hear that correctly? It was hard to hear.
Yes, ma'am.
It's a ratification.
Ratification.
I have you, Nicole. It's a ratification bonus, meaning that upon signature and acceptance by this board and the union, that there would be a payment, a one-time payment.
Effective October 1st, or when's that payment?
Yes, a date of ratification of this agreement.
Which is effective October 1st, right? Or,
Yes.
okay. And was there any discussion with the union about the PIHP RFP and the potential impact that that may have?
Yes, there was a quite a bit discussion about that, and that was a topic actually centered around our negotiations, in fact.
But I don't read anything in the contract regarding that. Is there a rider or something that, like, this is only in effect if we continue as a PIHP?
No, I think part of the negotiations itself was that we were able to limit any increases for a 3-year period that allow us to stay stagnant. So there's only a one-time increase for any tenure and then the one-time ratification bonus.
Okay, but we fundamentally, so OCHN will continue on as CMHP. OCHN is signing this agreement, but we will fundamentally be a different entity on October 1st if the state's RFP goes through.
Well, allow me to kind of clarify something. So when we became a CMHSP and we were separated from the county, we then had a union as well. So actually our union originates under our CMHSP.
So what happens under the collective bargaining agreement if we have to let, trust me, everything I'm saying, I hope never happens, and it's just painful to even mention it, but as a fiduciary of the OCHN entity, if we have to lay off, X number of people, what is the contract, what say under the collective bargaining agreement that we have to do in those instances? Well,
we would have to notify the union and try to work with them, but ultimately, it would be just like any other at will. We would lay off, and if we were to bring some people back, we would do so in accordance with the agreement. And I believe that's based on the seniority.
Can I just jump in on this?
Yeah.
There's not a no layoff provision in the agreement, right?
No.
No, their union employees are subject to issues that may arise with any company or organization, and so we're not locked in. Like I said, there's not a no layoff provision in this contract.
Absolutely not, and
Right.
Everything that we do is subject to our management, which means our overarching operations itself.
Right. Okay. Right. Just to clarify that. Yeah.
There is a section on layoff and recall, but maybe if you could line in there called super seniority. Give a definition of that.
If Nicole, do you have that handy? I don't have the CBA in front of me, but I can try to give you based on my memory.
Okay, fair enough.
Yes. Could you repeat the question?
Define super seniority.
So those are individuals who were employed with the OCHN prior to the privatization. So folks who were employed, I should say, under the county realm. And I would also defer to the CBA. I don't have it in front of me either, but based on my memory, that is how it's defined in the collective bargaining agreement.
Okay, so they would have been with us prior to what you described.
Correct. So when we were with the county prior to us separating to become an authority.
Okay, all right. So they've been here a while. Okay, go ahead, Chris.
So what, we're December, this is October 1st. What's the rush now? Can't we wait till the February time period when the state says they're going to award the RFPs?
Why would we do that if we have an agreement with the bargaining unit?
Because we fundamentally could be a completely different entity when this goes into effect.
There's no impact on our operations by entering into this.
But what's the impact of waiting until we hear where the RFP is going to come out?
I just think, my personal opinion is, I think that's bad policy. I don't think that's a good policy. And I think if we have an agreement with an organization, it's taken us, a little bit longer than October 1st, I think that we should ratify it. And they've all ratified it. So it doesn't hurt our operations. And I don't want us to be accused of bad faith bargaining, that we went and entered into a bargaining agreement with them, and they ratified it, and then we said, oh, no, you gotta wait, because I don't think that was part of the discussion. Okay.
And
Okay,
I
but-
do fear that that might be an outcome. We might be faced with an unfair labor practice if we do not continue to bargain in good faith.
Yeah, although there's an unprecedented circumstance in which our very existence could be non-existent by the day of this bargaining agreement, and it's weird that it's not even mentioned in the agreement.
Well, go ahead, yes, Dr.
No, I just want to ask, so this bargaining agreement was supposed to be from 10/25 though, correct? Like up there it says 10/1/2025, or is this for 2026?
2025.
Okay.
Correct. So when we started the negotiations, it just happens to be that way. So we all agreed that we would go back to the original date to ensure continuity of the agreement itself.
Okay, so I think maybe that might have been part of the...
I do appreciate that clarification.
Okay, any other questions? So this is a vote in the Finance Committee to move to the board, or are we taking?
Correct.
action today?
Nope, it will go for final approval at the board meeting, so it's a vote for the finance committee.
All right, and we do have a full house of finance. Good. All right, so I need a motion to move this forward.
So moved.
Second.
Roll call vote, Sheila?
Mr. Furman,
Yes.
Dr. Giles,
Yes.
Pastor Jones,
Yes.
Dr. Guadalupe,
Yes.
Mr. Young,
Yes.
motion carries.
Thank you. And I would agree that this typically, once it's ratified, boards need to accept. I know if, in my other life, if we waited more than 10 minutes to move it to the board, there would be a unfair labor practice. So I think we got to keep this moving. All right, we'll see you next week. What?
I'm next on your agenda as well.
Connor's going to cover the next subject. too.
Oh, right, well, for this one. All right. So
Okay.
we're in Finance Committee now, or what are we doing here?
I'm sorry,
We're going into the closed session.
Okay.
We need a motion, though.
So moved. Support. I'll say, excuse me, I want to, that we're going to move for consideration under attorney-client privilege matters under MCL 15.2681H. That's my
Question,
motion.
do we have time to do our first round of public comment before we go into the closed session, or are we in a rush?
We're going to wait till after because we only have legal counsel for a short period of time tonight.
Okay, sorry.
We need a roll call. Did we get a second? Yeah. Okay. Need a roll call vote.
Mr. Young, Mr. Furman,
Yes.
Dr. Giles,
Yes.
Pastor Jones, Dr. Guadalupe,
Yes.
Ms. Woodruff,
Yes.
Dr. Hans, Ms. Korenchik?
Yes.
Is that right?
Karencheck.
Korenchik. Sorry, I'll get it. Correct. Mr. Smith? Mr. Cowan?
Yes?
Motion carries.
Okay.
Hey, Sheila. I was missed for roll call. And then, yeah.
Did I skip you?
Dr.
You got
Giles?
taken off my sheet. Yeah. Dr. Giles? I got Dr. Giles.
For some reason, it's not turning on sound. Can you come here for a minute? You. Because I want to see why it's not, the sound isn't on.
Sherry, they're in closed session.
Oh,
That's
thank
why
you.
there's no sound.
Great, thank you.
We will now begin public comment. Is there anybody online?
If you are online and wish to speak for public comment, please raise your hand at this time.
Anybody in the room? Mr. Craig Brown, you have 3 minutes. Yes.
My name is Craig Brown. I'm a resident in Oakland County in Clarkston, Michigan. I am a retired high-level corporate executive with a variety of finance jobs I've held and in the last decade plus of my career, I had a unique skill set that was perfect for the mess that Detroit was at the Great Recession. So most importantly, though, is those experiences have come with me. I've spent the last 5 years plus. More closer? Okay. Is that better? Okay. As the chairman of the board of one of the largest direct care providers in Oakland County. Now, my wife and I have 2 wonderful sons, but they have profound autism. They are the type that require 24/7 care. And we have been receiving services through OCHN and its predecessors for over 30 years. So we've naturally seen plenty of accomplishments and plenty of challenges. The rebasing was probably as big a one as I remember as we went through things. But the recent years and recent months have been the most troubling of all those years. We, like you, I'm sure, saw tremendous pressure that had us eating through reserves and buffers that we needed. And then at the same time, seeing the pressures from the RFP and the process and the rest. Now, as those pressures have come forward and we've faced them, everybody's been called to action. But within how I'm seeing this responded to, it troubles me that I'm seeing and hearing an awful lot of metrics thrown at me and other things, especially when it comes to percentage administrative overheads, where I'm developing a concern that the pressures are essentially pushing a loss of focus on the core mission. This is natural in any situation like this. You have large funds that move through a very complicated process before they get to the individual. But once you start talking about funds and start talking about money, it's easy to have the mission get lost. And I have seen that a lot, where $5 a share threw all strategy out the window in a corporate transaction. Now, I know that there's been pressure that has caused you to go pull things in-house. You've also had to go out there and essentially, need to revisit many other things. But how that's been executed has had many issues with it. There are a lot of people that, as it was brought in-house, had work programs that are now cared for in their direct care setting because they don't have a place to go work. Transportation, which is key to getting individuals to be part of a community, has been hurt also. But the low point was essentially attending the meetings where, in a confusing fashion, those who had EOR and CLS seemed to have cuts that they didn't understand and everything else. And it didn't seem that the administrator knew that many of them had not been paid for a significant period of time. Now, my wife and I, others, have recently received numerous vague communications about our sons with very high level of need are getting their support with authorization issues and the rest. That sends us down for 3 or 4 months down a rabbit hole where there was a lot of pointing back and forth and we couldn't find out what information was really needed, what the problem really was, and how something they'd always had all of a sudden needed reauthorization. And at the same time, looking at the pressure throughout the entire system, there's other things I don't understand in terms of financials, dual CFO positions that appear, from what I researched online, to be looking as preparation for the future. So my summary really is, under pressure, the mission gets lost. And everybody here fully knows what that mission is. It's about individuals with disabilities, it's about people facing drug problems, it's about all those things.
Can you wrap?
What?
Can you wrap?
Yes. Okay. So there'll be a need for systematic change because obviously it's coming whether we want it, like it or not, because everything is not going to get funded the same way. But as that is done, I'm pushing everyone not to lose focus. It may sound preachy, I apologize for that, but I've seen the focus lost way too many times as someone starts throwing around numbers and budgets. Thank you.
Mr. Brown, we value your time, and you will receive a response from our customer service department. Thank you. Actually, before we move with the approval of the agenda, I would like to introduce our newest board member, Dr. Korenchuk, Dr. Jennifer Korenchuk. If you want to say a couple words.
Good evening, everyone. Hello, I'm Dr. Jennifer Korenchuk. I'm a licensed clinical counselor and owner of a private practice here in Oakland County focusing on kids and teens, and I am honored to be a part of the committee. Thank you all.
We welcome you. Thanks. Is there a motion for approval of the agenda with the noted changes that have been made? Support. Any discussion? All of those, hearing none, all those in favor say aye. Aye. Hearing no opposition, the motion carries. The next item on the agenda is our funding year 25 annual plan outcomes report from Mrs. Carley. Oh, Trish is doing it. Okay. Just following the agenda.
I apologize. No Frances today. She's delegated to me. So Tricia Zumbo, Chief Operating Officer, here to give final reports on our strategic plan and fiscal year 25 annual plan, and give you some highlights from that. And just as a quick note, you will have the final written report once the financial audits are complete. So those will be down the road a little bit. But we want to give you a highlight. So we can move to the next slide, please. So this was the last year of our last strategic plan. So this is fiscal year 23 through fiscal year 25. Our focus areas are listed here, which differ slightly from the current focus areas we have in our current strategic plan. So we're going to go over each of these and what the goals were and some highlights from those. Thank you. So we have here fiscal year 25 individuals served. I do want to highlight that this does not include crisis services. So we have served 29,085 unduplicated individuals through SUD, intellectual and developmental disabilities, children with SED, and adults with MI. Next slide. Under our first focus area of administration and service delivery, we have listed here some of our 3-year highlights. We have made our way and worked through enhancing the managed care system and processes with VDT, which is a population health tool, Landis, which is a contract center software. We have MedVersant, a credentialing software, Cobblestone, another contract management software. We've also utilized our learning management system, Docebo, to deliver education and training, not just internally, but to our outside network as well. And a few of the highlights that are listed here go to our commitment to conflict-free access, our transportation and self-determination services that were moved in-house, as well as our NCQA reaccreditation at 100%. Next slide, please. Continuing under this focus area, there were 2 goals here, and this was to increase the efficiency of payment structures and processes, with about 4 objectives underneath that goal, as well as the goal to improve our overall administrative operations with a few objectives there as well. So some of the highlights here are implementing our fee-for-service transition and standardizing rates across services and providing that equity in our network. We launched a claims department to support that shift from service models to fee-for-service. We have biweekly provider updates, quarterly all-provider meetings to promote open communication with our providers. We had multiple fee-for-service provider work groups over the course of about 6 to 7 months as we made that transition, as well as fund source management processes and policies within our budget and finance team. Next slide. Under our integrated healthcare, a few of our highlights here. I want to highlight our jails and our courts. Our justice team works very closely. We are contracted with several different courts. One I want to highlight is we were contacted by the 43rd District Court to partner on treatment court for fall of 2024. We obtained a federal and state grant for more than $2.4 million for assisted outpatient treatment, which began in fiscal year 24. And overall now we have 5 justice liaisons embedded throughout 4 different courts within our county. Some key progress in our health homes is our integrated healthcare and our participation in the health home model. And within fiscal year of 23, more than 1,000 were enrolled in our behavioral health home. I mentioned earlier our population health tool, and so we did implement that software, which includes our HEDIS metrics and screening tool to assess the social determinants of health and dashboards to improve care. Next slide. A few more highlights we have for fiscal year 25. Our co-responder program has expanded in fiscal year 25. I will give you a little highlight. It's even more now in fiscal year 26. But we've expanded to 20 communities and responded to almost 5,000 referrals, both in person and sent in by our law enforcement partners. Our behavioral threat assessment and management team was stood up and has now reviewed more than 50 cases. Our crisis team works with providers to continue to improve crisis services, and we did hire a mobile crisis coordinator. Our community violence intervention project with the Greater Pontiac Community Coalition and the Chance for Life engaged more than 500 individuals. And our clinical team continues to participate in work groups with our Medicaid health plans. Next, we have our partnerships, advocacy, and community outreach. So some highlights over the 3-year strategic plan include moving our direct we'll fix that. All right. So, January of 2024, we have moved our direct support professional training in-house. Some of you may remember prior this was contracted with MORC and with TTI to provide that training. We have since moved that back in, and as of October of 2025, we had more than 9,400 users who had taken over 90,000 courses in our Docebo LMS for direct support professionals. We have our ongoing legislative outreach and annual breakfast. We launched SUD prevention campaigns, and we really enhanced and strengthened our partnerships with our schools, jail, courts, prosecutor's office, sheriff's office, and dozens of our local police departments. Next slide. For fiscal year 25, some of these highlights include our goal to strengthen our strategic partnerships with Oakland County, which was led by 4 different objectives there, as well as strengthen our partnerships with community leaders, educational institutions, other healthcare entities. And we did that in collaboration with some community events you've seen here. 2 of the new and innovative events are our Veterans and SUD Resources Fair, and I'll take this time to plug our Veterans event that will happen here tomorrow. And I believe it's a drive-through, food drive-through with resources and food for our veterans. As well as we're getting close to 500,000 website views, and our training team hosted 343 trainings for over 8,000 individuals. Next, under our quality system of care, some of these 3-year highlights include assuming management of our RISE Center, which is Recovery, Information, Support, and Education, which is located in the Resource and Crisis Center. We spearheaded and implemented the Youth and Family Care Connection, again, over at the RCC, as well as launching our Mental Health School Navigators Initiative. Some highlights specifically from fiscal year of 25 was our Oakland 360 Care Center. This has been a great collaboration with OLSA, the Health Division, and Honor, where we have an integrated walk-in clinic. It's over right off Woodward on the Loop. It's the old Arts and Media School, where we have launched that. We have a clinician embedded in the South Oakland Health Center over on Catalpa at the Health Division. We have more than doubled our families served by our school mental health navigators, and then successfully transitioned our transportation services for more than 2,000 individuals. Next slide focuses on 3-year highlights for staffing and retention. So again, our direct support professional training curriculum, very proud of that. There's 29 different courses that meet all of the direct support professional training requirements there. Our HR team has participated in multiple career fairs. We have co-ops and interns who have been hired and retained here as OCHN employees, as well as something that lives close to my heart, our Inclusion, Diversity, Equity, and Accessibility initiative through our organization here. Next up, for our fiscal year 25 highlights, we were named as a 2024 Detroit Top Workplace in the Detroit Free Press. Staff engagement to support morale. You'll see this image here where we had our Lions-themed staff meeting. We have different events that promote behavioral health as a career choice, as well as, again, the IDEA work group staff-led engagement. And that is going to wrap up our fiscal year 25 highlights, and I will open it up for any questions. Mr. Smith.
Are there any questions on the policy committee first? Mr. Smith.
All right, Tricia, I swear to you that I'm a glass half full guy. I told you I'm an optimist. I truly am, but I'm not the glass is always full guy.
Yes.
Last year, didn't go as well as you had hoped, and how are we taking those learnings to improve this year?
Yeah. So I think as a team, we continuously meet and talk about that. We talk about what our barriers are, what our challenges are, how we continue to move forward. Dana is a huge proponent of us being solution-focused. So I think overall, I will say we've met the goals and accomplishments that we wanted to meet. However, we have learned from those processes and those journeys on how we continue to improve for the next project that we have. I think one of the things that we will continue to work on and that you'll see that transitions over to this year's strategic plan and this year's annual plan is provider communications, provider relationships. How do we continue to strengthen those? So I think with the goals that we have met, and again, you'll have more of the detailed report once we get the financials, we look at where we did succeed, where we can improve and do better, and maybe where there are things that we need to kind of rethink overall. So that's probably, I would say, on a weekly basis, things that our team discusses.
Any other questions on?
I'm not sure that I have a question. I guess my partner here has just really opened the door for me to say this. I looked at the numbers and what have you, and I want to comment, don't lose sight of the mission that I heard tonight. And I would tell you, with the implementation of the fee-for-service, the implementation of the transportation, it was some rough waters, but you guys got us through it. And the idea that the whole team worked together to make that happen, these slides are good news for us. Because what it does is it sets the pace for what we'll do next year and staying focused on the mission. So thank you for opening that up in relation to how you got through it, okay, some ups and downs. But I look at that and I see the success that's come out of it, okay, because it was some rough waters in relation to the change. No one likes change. But the idea of what we went through for the transportation piece, what we went through for the fee-for-services piece, really caused change. But it ended up being a very successful effort by each one. It doesn't mean we don't still have improvement, because you have to look for continuous improvement. But that really shows that it worked out very well in that program. So thank you.
Absolutely. Thank you, Pastor Jones. We have an extremely dedicated team. And so our directors, our managers, our supervisors, our frontline staff all played a piece in this. And I'm extremely proud to lead an organization like that.
There are no further questions. Mr. Cowan.
So, with the basis that you learned from issues and kind of continuous improvement type thing, when you look at this coming, unfortunately, we deal in a fiscal year.
Yeah.
So, as you look forward, we're already into December. What challenges or roadblocks do you see coming up in terms of the providing of services?
Yeah.
You know, I know we got a lot of other issues that
That's a loaded question.
There's a lot of noise,
Yeah.
you know, from Lansing and here and there and Washington D.C. But in the actual, you know, providing and delivery of services, assuming things stay the way they are this year, what are the challenges or difficulties you see you need to overcome?
I think it's a lot to navigate right now with everything that changes at the federal level, at the state level, changes we have here locally. And so I think one of the things that is usually forefront in my mind is how that impacts the individuals we serve and how we continue to ensure that they receive the support and the resources and services that they need. And I think second on my mind is supporting my staff to be able to do that work, because it's a lot of work and there's a lot of, I always say, robust conversation around the table on how we improve things, how we move things forward, and we encourage that. I think the barriers are a lot with funding at the federal level and at the state level. that allows us to do what it is that we do. And how do we navigate that when things change almost on a daily basis? And it really is, and I hate to use the word unprecedented because I feel like that's overused in the last 5 years or so, about what we're seeing at the federal level at the same time that we're seeing what we're seeing at the state level as well. So I think one of my huge challenges is how do we ensure that people that we serve feel safe and supported, and then how do my staff feel safe and supported as well so that we can continue to do the work that we do.
Thank you. Unfortunately, the board does not have a magic wand to wave away all the uncertainty, but I think we're all united in the fact that we support our team, we support those we serve, and we're going to navigate it together. So that's what we're going to do.
And we appreciate that. Thank you.
Thank you.
Thank you for that report, and I think it's a good point that provider relations, you are going to address that, how to improve that. One other thing I want to point out is that some of the issues that have come up in front of the board, the timeline is kind of quick. Like sometimes we have been informed in the afternoon of some key issues that need to be discussed and addressed by us. So I would hope that we are given a little more time to such issues that come up, and not like 10 minutes or 2 hours before we go into a closed session sometimes to address some of these issues. I think if that could be improved, would be helpful to the board. Thank you.
Absolutely. I think board communication can definitely, and when we can, I think sometimes we get the information pretty quickly as well, but that's definitely something that we can work on and continue to do that.
Yeah, and we can always ask for a special board meeting. We have done that historically in the past when things like this come up, and I think that would be helpful. Thank you.
Great, thank you. Thank you.
Thank you. As soon as Trish puts the table and chairs back together again, we'll have Richard come up. He did some disassembling.
Testing. All right.
There we go.
All right. We have a quick update for finance for the month of December, or for this month in December. Just a couple of highlights, and there is a memo that was distributed in your packet. First, I want to highlight FY25 or fiscal year 25 closing. So our closing process is ahead of schedule compared to prior year. Some key progress updates are included in the memo. Final eGrams grants were submitted by the beginning of December, which is the date that they were due. Fiscal year 25 cost settlement calculations are being finalized with core providers related to the closeout of those service models, again, most of which ended June 30th, with a couple that did continue until September 30th. So we're in that process. We're actually calculating those today still and tomorrow, with the expectation that we'll get those reviewed and approved by leadership and distributed by the end of the calendar year so that we can start that process with providers. So that's our anticipated timeline, a few months ahead of our previous year timelines. All final fiscal year 25 claims are expected to be received by the end of the week this week, and we're hoping to pay those prior to the end of the year. So that will allow us to begin the reconciliation process between our general ledger system and our electronic health record system. So again, ahead of schedule compared to prior years. Those three items, grants, the cost settlement process, and the claims reconciliation, are by far the most significant parts of our year-end close process. But all other general ledger accounts will be anticipated to be reconciled and closing entries posted by January 31st, 2026. This puts us in really good shape for our year-end financial status report that's due to MDHHS by February 28th, 2026, and a target financial audit completion date of March 31st, which it would be 90 days ahead of prior year when we completed it approximately June 30. So again, March 31st, 26 is my target. So aggressive, but again, moving the organization to a point where we'll be aware of where we ended fiscal year 25 a few months faster, and we can react more quickly to those results. The next area related to fiscal year 26 financials, as has been past practice, so this is consistent with prior years. October financials are not prepared at this time, given that claims, again, so claims for the month of October, we received those, some in October, some in November, and some in December. So we do expect that having one full month of claims is important to be able to project out claims experience for the financial statements. So we will bring year-to-date November financials in the month of January. So our first financial statement for the new fiscal year. A couple of highlights related to the budget for 2026. So we have received our first 2 months of payments from MDHHS. And at this time, the revenue that we received in the months of October and November is approximately equal to what we budgeted. So good news that revenue that we're seeing come in the door, cash coming in the door, is approximately what we budgeted, and we're not seeing that continuous slippage or reduction in eligibles and revenue as associated. So that's, again, not a guarantee that we won't see it later on in fiscal year 26, but it's a good start to the fiscal year that hopefully we will not see that continued trend. A couple other highlights just real quick. While budgeted revenue appears to be in line with expectations, the CCBHC direct pay continues to provide significant uncertainty regarding the expenditure reduction that we will experience. So our budget did assume that we were going to lose revenue related to CCBHC direct pay. It also assumed that the expenses would reduce proportionally. And it'll take us a couple of months to analyze, is the expense reduction reducing as much as we anticipated, as there are things being worked out between, again, the CCBHCs getting directly paid versus billing those services to us. And then finally, we do continue to hear from the network a need or a desire for increased service rates, and we do anticipate continuing to evaluate the impact of both the direct pay CCBHC as well as utilization trends within our fee-for-service to determine if a mid-year rate adjustment is financially viable. So that's something that we'll do probably in the first quarter of calendar year 2026 would be my hope. So high level, again, for the first month as we start talking about October and the budget impact, I wanted to keep the committee informed of kind of what we're seeing preliminarily in this fiscal year, which right now is positive.
Questions from Finance Committee? Sarah? Just use your outside voice.
Thank you. Just a quick question. It sounds like things are going really well, so great work. Thank you. How is it that things are getting, did you find a more efficient way, or kind of what's changed that's put us in a better place of having things in a more timely manner?
So there's a couple things. The decision to move to fee-for-service earlier in the fiscal year rather than at the end of the fiscal year does help because we were able to start the reconciliation process a little earlier. So that is part of the process. And some of it has been the ability to look at kind of what have been the bottlenecks or what have been the barriers to moving things through the process and trying to move those a little faster. So it's a combination of things. You know, we are bringing in some support. Raymond has brought in some support for the staff as well to try to help move things through the process. So I don't want to credit it to any one thing, but there have been kind of systemic change that's helping move that process forward. But a big part of it was, I think, the decision to go ahead and move to fee-for-service, again, earlier in the fiscal year that allowed us to start the process probably two months ahead of where we would have started in the past.
Oh, that's great. Thank you so much.
Any other questions from Finance Committee? Policy Committee? Chris?
actually have a policy question for finance to make this medical. So I hope this is a fair question. We heard in public comment, and I'm hearing from the community a lot about utilization management decisions that are coming out, policies on the CLS, which in particular, which we've heard about and I've heard about from the community. And that immediately, from the community voices that come to me is like, look at OCHN, they're installing red light committees to cut out expenses and cutting expenses and utilization, using utilization management. Is there communication between finance and utilization management, or is there a brick wall between those two functions?
I mean, so I wouldn't say that there's a brick wall between the two functions. Finance needs to understand what utilization management protocols are in place and needs to understand what the expectations are from a utilization management perspective, both from a budgeting perspective, because we use those anticipated authorizations for services to inform a budgeting process or a rebudgeting process. But one of the things that's very important to understand is that because of how medical necessity is considered, right? Medical necessity is not supposed to take into consideration the financial impact. It has to be based on what is clinically necessary. And so in the role of finance, and I'll only speak from the finance role, we do not have a say in whether or not something is authorized as it relates to what it might cost.
And so can we, and that you've made the point exactly that I was hoping you'd make, that the decisions regarding IPOSs and approvals and authorizations and that shouldn't be the financially driven, and you can assure the community it's not.
That is not I do not get to make those decisions. That is correct. That is handled in a different department.
And you're not making suggestions to utilization management as far as ways they can make policy decisions?
That is not, I am not qualified to make those types of recommendations.
Okay, thank you. That's the assurance I was looking for. Thank you.
Other questions? All right, a couple things. So good news that audit is back on the faster track. That'll help as we get towards the end of the year. You talk in terms of revenues on track. So we had a rate adjustment fairly late in the last fiscal year. Rate adjustment up, fortunately. So I'm assuming that held as we're into this year.
We actually saw, well, yes, the rate adjustment held, but then again, because of the CCBHC direct pay, we saw a reduction. So there's a couple of things that are kind of confounding that. So right. Total revenue will be down compared to last year, but if we are correct that the amount of expense that should reduce with the CCBHCs being paid directly, then the net impact was a rate
so our net
increase.
Should be a little better.
Little better.
Can you and Dana explain for our new board member, the CCBHC, because I think we've gone nonstop, all of us, on acronyms this meeting. New record.
I'll do my best, and then Dana will correct me. So CCBHC stands for Certified Community Behavioral Health Clinic. There's a special certification that they are required to receive from the Michigan Department of Health and Human Services through an application process and through a certification process that is required through the Center for Medicare and Medicaid Services, so a federal demonstration that we have in the state. We have two in Oakland County. We have CNS and Easter Seals, MORC, that meet the CCBHC criteria. Historically, our capitation payments that we got from MDHHS would come through us, and then we would have a responsibility to pay for every daily visit, so every day of service that was provided under the CCBHC. We would have what's called a PPS1 rate, or a prospective payment system payment rate that we'd be responsible for. Effective on October 1st, 2025, MDHHS made a policy decision to make that payment directly to the CCBHCs, and so they did their best to try to reduce the amount of revenue that we get to then pay those CCBHCs directly. And our hope and we'll be evaluating this, is that the amount of revenue that was removed from our budget should be approximately equal to the amount of expense that would also be removed, because they'll get that payment directly from the state of Michigan. So that's the kind of the finance aspect. I know there's a lot more to CCBHC than that.
So, like Richard said, we have two. We have CNS Healthcare and we have Easter Seals Morgue. And part of the CCBHC certification is that they are responsible for providing a smaller array of services. And this is to improve access for individuals who don't meet traditional community mental health criteria for receiving CMH services. And with that, those who are directly served by the CCBHCs are paid for by the state, and those who are sort of shared in terms of the service delivery, they need services outside of the CCBHC array, we share in that payment of the provider. So it's still fairly new, like Richard is saying, in terms of how they pay for those services. So we'll see the full impact probably in about a year, I would think, maybe sooner. I know we're seeing the impact in terms of dollars that shifted from us directly to the CCBHC for payment, because we only really received a 1% admin cost, which really is not a whole lot. But there are some other things that have occurred with that in terms of questions related to crisis services, questions related to, what is the other one? Crisis and thank you, ORR, recipient rights. So we're still working very closely with the state and with those CCBHCs to make sure that individuals that are served, including those that are only served by the CCBHC, we don't have a rights responsibility for them, but if they were to come to us and express a concern or file a complaint, we will follow up on that for sure.
All right. Thank you both.
Thank you.
Thanks, Richard. So this is just an update. There's no receive and file even, right? Okay. Oop. We're done. Back over to you, Yvette.
Thank you, Mr. Young. Next on the agenda, we have Ms. Suzanne Warner, Events and Outreach.
Good evening, everyone. I'm Suzanne Weinert. I'm the Director of Communications and Community Outreach. Nice to meet you. Just want to give you some updates of some events that we have going on. Tricia already stole my thunder about the Vets Drive-Through Resource Event. No, that's okay. Just want to mention a couple other things that happened last week. We had a training, applied suicide intervention skills training, as well as the Metro Region meeting was last week, and I know a few of you were there, so thank you all so much for attending. There's a lot of great information. As Tricia mentioned, we're going to be busy in our parking lot here tomorrow with, I think, some fun weather coming, but we will brave through it because it's super important community resource and effort for our veterans. We have a couple hundred already signed up to come through. They will be warming their cars, and we will make sure that they have lots of food and some gift cards as well as resources. So we're looking forward to that. It is from 9 to 12 tomorrow here in our parking lot. Also wanted to mention a couple other events that we are participating in. We have an adaptive event that we're working with Oakland County Parks. Their Jingle Bell Ball. This is our second year participating in that. Am I still working? Okay. Also, our mental health school navigators are going to be busy with a school career fair as well as a community health fair. And then we are, I also wanted to mention a reminder that the OCHN board holiday reception is next week prior to the board meeting. It's going to be held from 5 to 6 on December the 16th. So we'll have light refreshments and opportunity to gather and just kind of meet and greet individuals, so hope that you can be there. Also wanted to mention our job fair that we have coming up on the 17th, and that is going to be at 10 a.m., 10 to 4. And we already have, I want to say, around 40 or so people registered, so we're really excited that we've got some people coming to the job fair, and it's for various positions that we have open, and they can be found on our careers page on our OCHN website. Next slide, please. This is another event, the adaptive type of event that we're participating in, as well as some trainings. And then I also wanted to mention our annual Law Enforcement Appreciation Breakfast. We have that coming up on January the 12th. So we're starting the year off right. Law Enforcement Appreciation Day is actually the 9th, but we opted, since it's a Friday, we opted to host it on a Monday as we usually do. So we're looking forward to that. We're looking forward to honor our law enforcement partners at that event as well. So we hope you can join us. Also wanted to announce that we are in the next cycle of the Traveling Art Fair, the Traveling Art Show. So we'll be accepting submissions for artwork on starting January the 12th through the 23rd, and then we'll have an opportunity to view that artwork and judge as well. There are also some additional trainings that are coming up, as well as we'll be participating in the Kevin Song Conference coming up at the end of January that Dana will be part of a panel. Next slide, please. Just some updates on our press releases that we're doing. We've already done the mental health tips during the holiday season, as well as we'll highlight our veterans event and then our ongoing outreach and room usage. And I'm really sorry you don't have any photos. I will have some photos for you next month to show you with our vets event drive-through after tomorrow. That's all I have.
Any questions for Suzanne? Well, we thank you.
Thank you.
And we've come to the second opportunity for public comment. Anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time.
Okay. And no one else was on the sign-in sheet. We do have an update from our CEO.
Good evening again. At the request of this board, as well as just a general public update, I just wanted to talk about the timeline for the transition of crisis services. So we started the real work of this early in May and had several meetings, and also was a part of our annual strategic planning process that was presented to external stakeholders as well as this board. And then also in June, we actually notified the Michigan Department of Health and Human Services that we had the intention of transitioning those crisis services as well. We also issued a formal intent about our transition to Common Ground in that same time frame. And then also we attempted to contract and do a transition meeting early in that time. And at that point, we wanted to make sure that we were clearly communicating with our vendor to make sure that they were assured of what and how we would transition those crisis services. So as we moved into the second phase, we looked at contract review, planning meetings, and increasing documentation. And between the months of July and August, we actually met with Common Ground several times, talked about their cost settlement for fiscal year end, and then also assisted in recurring and contract transition meetings that occurred. In August, we focused on our meetings to talk about the contract for fiscal 24, 25, and 26. And again, attempted to talk about transition planning. And honestly, at that time, some of the communication broke down a bit, but we stayed on board and also made sure, again, in September, we presented this plan to Common Ground and also provided a written transition plan. So another critical event, of course, the events occurred in October. Again, giving the transition plan and sharing that transition plan in a meeting we had October 8th, and then following up on specific contract terms and facilities, including the sober support unit. Mid-October, OCHN did sign a transition letter and responded back to Common Ground. And so those are just a lot of little administrative things that went back and forth among our team and the Common Ground team. And then in October, they did sign their contract for fiscal 25. And they also issued a non-signature letter in November as it relates to fiscal year 26. So again, a lot of meetings that were held, and you all are aware of the transition meetings and the presentation to the Board of Commissioners. And then last week or the week before, we had a meeting and presentation with the Board of Commissioners. And then thankfully, we are now working very closely with Common Ground, and we reinitiated those talks and discussions about the transition plan. So on December 2nd, we did our Oakland County Board of Commissioners presentation to their Health and Safety Committee and let them know what our plans were moving forward and to keeping them informed. And then on December 4th, we actually met with Common Ground's leadership. And I have to say, this was a successful meeting, I think, on both sides, because we really wanted to make sure that we were communicating clearly, and they had an opportunity to ask questions. We talked about documentation and plans and other additional meetings. We also talked about some key dates, and some agreement on those dates is still pending. We have a few outstanding questions. I wouldn't say outstanding to the point that we can't decide on a final date of the transition, but it was really positive that we were able to have this conversation and really move this transition plan forward. And so a lot of different feedback, but mostly the most critical piece is I think we're all on the same page about how we want to better serve this community and better serve individuals who are in crisis. So I'm happy to report that we continue to meet, and we will be meeting again, I believe, tomorrow. And so as we meet and have updates for this board, I'll bring them to you every meeting if I need to. But pretty much I want to make sure that there are substance and that we are moving forward with phase 1 of our crisis transition plan, which is slated to February 1st, January 30th of next year.
Just a quick question. It does sound like it got pushed back a month from where we had what we initially thought. Wasn't it beginning of January?
No, it was at the end of January.
Was it?
So, yes.
Oh,
it was.
okay.
Yeah.
I thought it said beginning of January. Are we working on that communication pathway with community and, okay.
Absolutely, and that's one of the things that we talked about doing a joint communication. So that was really positive, but I do believe, and this is understandable, Common Ground wanted to have that first communication with their staff and prepare them, as well as meeting with the department, the county department, who would assist with any staffing changes and things of that nature. So we both actually met with them on separate occasions at the county level to talk about any potential staff transitions. And so part of that job fair on December 15th will be to talk about opportunities that will exist with the staffing.
How is that looking right now? Do you know?
In terms of
staffing?
Well, the job fair will give us, I think, Suzanne said there are 40 people that are already signed up to come to the job fair. We've already done some hiring. And I think with this plan that we're working on, and we're working through this transition with Common Ground, I think people will have or feel as if there's a real opportunity to transition over if they choose to.
Thank you so much. Appreciate it.
Thank you. I'm so sorry about the IT or the technology is not cooperating.
Thank you for that update, and it's a little bit reassuring. My question is this, and right now the staffing is going to be a key factor in continuation of services, crisis services. My concern is for the month of February. As you know, cabin fever sets in. I mean, we are already in that stressful period with shorter daylight hours, etc. So sometimes in January, once you have a little clearer idea of staffing, could you provide us with some contingencies in case of
Absolutely.
things fall through the cracks?
The original plans were to really have some overlap in staffing and common ground, and our team discussed some of the challenges with that, as well as, you know, the positives and negatives, and making sure that people were properly trained and ready. And I think one of the positives is the fact that we are going to be open and hire people who already work in those positions.
I just wanted to supplement what Dana said. We all will remember our last board meeting. I and Mr. DeBruzen, who's the chairperson, agreed to meet. We did meet face-to-face the week, or I think the Monday before Thanksgiving. It was a very positive meeting. We both felt it was important that we have open lines of communications at the board level, and that was accomplished. And there's no decisions made by us because that's not our role. Both of us agreed on that, but we felt that if we had open line of communications as we move through the process, that would be important. So that has been accomplished. We continue to be in touch, and I think we were both, by the way, right after that, I think the next day or two, the meeting was set for December 4th, which is when you met. So I think some good came out of our board meeting and the exchange that we had with respect that both parties agreed we needed to get together and meet, and they did. So I think the process, both of us are pleased with the fact that it was a positive meeting, and that's kind of the feedback that we both got from the executive staffs of both organizations. So I'm pleased with all that, and you know, we'll just keep the lines of communication open, but more importantly, the two parties are meeting and getting this plan finalized because I have a better appreciation for having met with the chairman of Common Ground for some of the situations they're facing, and I think I communicated those to Dana, and some of those things are being part of the plan are being acted upon by both parties. So I think at this point we just need to let the two executive teams and others continue to meet and get things hashed out, and then we'll end up at a best place, hopefully for both organizations, when we get to February 1st. But that's just the front of the house, so to speak, transition, and we still have the other pieces to go. So I appreciate the update, and I think it helps all of us as we move through the process.
Next on the agenda is board comments, starting with Adam Furman.
Good evening. I'd just like to thank our public comment tonight, and also just a lot of good discussion as to our progress in the previous fiscal year and moving forward. I'd also like to thank all staff who had a hand in putting the agenda together tonight, and I'd like to formally welcome our new board member, Dr. Jennifer Korenchak, and I really look forward to working with you more. Have a good evening. Thanks.
Thank you, Adam. Dr. Sarah Guadalupe.
Just would like to welcome our new board member as well. Could you share your last name one more time, though? Because I don't want to butcher it.
Adam got it. It's Korenchak.
Korenchak. Okay. Welcome. We're happy to have you and look forward to serving with you. Thank you.
Mr. Smith.
Welcome, Dr. Jennifer. I hope you're okay maybe with that so we can make it easier. It's good. I think you're from Berkeley, and so it's good to have a fellow Bear on on the board with us, and look forward to working with you. I'd like to thank Craig Brown for his public comment. I've known Craig, I think, I was calculating in my head, I think for 16 years, he and his wife, Linda. And I just want the board to know what a fierce advocate Craig and Linda are, and how meaningful it was that he made public comment tonight, because I know it's not the natural thing he wants to do. And I think sometimes we look past potential allies and dismiss. Craig's not one of those. He wants to be our ally. I know that sincerely in his heart. So it's important to listen to him. And I do know his situation over the last couple of months, because he shared me the documentation, and I have passed that along with Dana and leadership, and we let them down. We could and should have done better over the last couple of months. And I don't want to put words in Craig's mouth, but I know how he and Linda work, and they don't want this to be about him and his children. What they're worried about are the people that don't have a Craig and Linda in their lives and couldn't come up here and speak, and who are in the exact same situation on these CLS hours, the transportation hours, and the authorizations, and the struggles that they are. I mean, these are real sleepless nights. These are real stress on providers making budgets, making payrolls, and people working through it. And if we don't have that heart and don't have that understanding, I don't know what we're doing as an organization, as a board. I know we do, but we got to put that forefront, because and always strive to do better. One last thing. I know we're on the policy committee, and I was looking at the bylaws as far as what the policy committee does. I'm actually looking at those bylaws and kind of need somebody to help me translate offline what the policy committee does, because the bylaws are kind of confusing on it. But I do hear the word policy, and one thing that came out of this that I didn't understand is, there's these policy bulletins, for example, that come out. And they come out under our letterhead with all our names on it. So I would ask, Ms. Woodruff, that we consider as a policy committee to have a standing agenda item where policies that either have been issued or are, and ideally going to be issued, get presented to the board, and it can be a receive, file, comment period, but to give the public a chance to comment in front of us, and to give the board a chance to comment on it. If there's no comment, great, it gets received and filed. But I know we don't have a traditional administrative rule system, but in administrative rule systems, you put the rule out there and you give a chance for comment. And so I'd encourage us as a policy committee to make that a habit on our part, particularly for things that go out under a letterhead with our names on it. So thank you.
Thank you, Mr. Smith. Dr. Hans?
So I would like to welcome Dr. Granchik on the board. You see, a lot goes on here, and I hope you will add your voice sooner than later. And thank you for all the public comment and written, and as well as Mr. Brown. Thank you for that. I won't add anything more to what has already been said. It's a lot to digest for us. This is my last board meeting for the year, so I wish everyone a Merry Christmas and a Happy New Year. Thank you.
Thank you, Dr. Hans. We will move over to Dr. Giles.
Well, I don't have much to say. I want to say welcome. And I want to say thank you to all of the OCHN staff. You are appreciated. The work you do does not go without being seen, but oftentimes we focus on what's not done, and I do that myself sometimes. What haven't I done? I never take a moment to look back and see what has been accomplished, and I think Trish showed us a lot of what was accomplished, and I just want to say thank you to the staff, because I know it's not easy to go into work every day and you aren't always complimented. You don't feel appreciated sometimes, but just know you are appreciated. The work you're doing it's being seen. And I wanted to say 56 cases were discussed for the behavior threat assessment. I was glad to see that number because that's telling me that people are not only seeing things, but they're saying something. So individuals are able to be evaluated and possibly get the help they need. So thank you, and thank you for all the work that you do.
Thank you, Dr. Giles. Ms. Christina Rude.
Just also want to say welcome to our newest board member. Have a good evening. Thank you.
Pastor Jones.
Wow, I was waiting for this moment. Listen, and let me just compliment whoever is doing this because they know give a preacher a mic and you're in trouble. And it works. It works. But wow. First thing I'd like to say is this. Thank Trish for the report because I thought that was real important to understand not only what we've done, how we've done it, but the success of implementation. So that's very, very important. I want to welcome our new member. I'm excited about being able to work with you, and they put you on a great side of the board. So really excited about that. We heard something about mission. Don't forget the mission. And, that is very critical to us. And the idea that we were able to open up the communication, I think at our last meeting, that's what we talked about, was communication. I really want to thank our board chair and our CEO for following up on that. So that's important. But if I could leave anything with us for this year is this board has a lot of varied opinions, independent personalities. But that's what makes this an effective board. And it makes it one of the most exciting boards ever because we do have a varied amount of opinions. We act independently. We think independently. And because of that, we're able to address the issues and bring them forward and then bring forth solutions. So thank you to the board. Thank you to the staff. And thank you and welcome, Jennifer, to our new meeting. I'm excited about having you. Thank you.
Thank you, Pastor Jones. Mr. John Young.
I'll just say welcome. You're coming at interesting times, and I would agree with Pastor Jones. There are a lot of opinions around the board, and despite what you hear from the studio audience, most of us live these things every day. So there is, there's more depth. So welcome.
Mr. Cowan.
Just welcome. Glad to have you. I just wanted to share, I had an opportunity to go to Dutton Farms today, and it's truly an amazing place. They do great work, and I'm pleased that we work with them, and they're a partner, and I look forward to learning more about the organization, but it was great to see all the people that they serve, and they do something very different. Who would think that a farm would be a place of service? But it is. So, and even got to help feed the goats. So I made an accomplishment today. I fed the goats. Thank you.
And Dr. Jennifer Korenchuk, do you have any comments?
Just thank you all for trying to pronounce my last name and for the very warm welcome. And thank you to Mr. Brown for sharing about your family. And I love this idea of coming in and with these messages of remember the mission. And Trish, for you too, my values align with yours in remembering the individuals we serve in our decisions and our work, but also the staff and making sure that they're supported too. I share those values. So thank you all so much.
All right. Last but not least, it was great for me to hear the results of the 3-year strategic plan. Of course, like the question that was asked by Mr. Smith, there's always room for continuous quality improvement. And of course, our mission is to serve our clients. And so it is my hope and goal that we will continue to do that in calendar year 2026. Thank you. If there's nothing further, we stand adjourned.